Welcome, Kate. It's good to see you. I'm going to get you to introduce yourself in a little while, Kate, just to give context. And just so people understand what this Infocast is really about, is that as we're still in the middle of this pandemic and we're entering the colder months, so we want to look at and explore what people can do to stay healthy in this period of time. But Kate, before we go any further, can you just sort of tell people listening and watching this who you are and why we're asking you as somebody with expertise in this area?
Yeah, sure. Thanks for having me. So my name is Katie Dowling and I am a specialist respiratory physio based at the Royal Brompton Hospital in London. I've been specialist in respiratory and cardiac conditions for about 7 years now. I've been at the Brompton for 5.5 of those. So that's purely seeing patients with heart and lung conditions. So yeah, since January, I have been specialist 2 days a week treating patients with pulmonary hypertension. So I'm in a bit of a split role, which is challenging, but also really, really interesting because it's really varied. So 3 days a week, I'm working on the wards, seeing people who are acutely unwell, needing hospital admissions or on intensive care. And then 2 days a week. So before the pandemic, I was seeing patients with PH in clinic and seeing them one-to-one, which was great. But not unfortunately, but we've had to change with the times. I'm now doing a lot more virtual consultation. So we're working on improving that service. Mm-hmm. I'm very kindly funded by the Pulmonary Hypertension Association, so thank you, because we know there's such a need for patients with PH to be seen by specialist physios and being seen by someone who's happy talking to them about exercise. So yeah, I'm funded by them, which is great, and looking at long-term plans and trying to develop the service, not only at the Brompton, but across all centres in the UK around supporting patients with PH and exercise and activity, really. So yeah, that's me.
Just to follow on then, Katie, from what you said there, how would you sort of articulate the skills that physiotherapists and physio per se can bring to the treatment pathways in pulmonary hypertension? Because it's not, it's relatively new in pulmonary hypertension and trying to involve this sort of wider multidisciplinary sort of approach to it. So what do you think physiotherapy and your colleagues can bring to the overall improvement of pulmonary hypertension and its treatment?
Yeah, for sure. So physios are renowned for, I guess, well, there's a stereotype physio, isn't there? Like being into exercise and being really active and encouraging people. I would say for me personally, working at the Brompton and being exposed to patients with pulmonary hypertension, but all the different types of pulmonary hypertension, so getting that exposure to the different causes of PH has been really vital in me understanding the condition and understanding what I can and can't do with them. And then as a physio, specifically having that understanding around exercise and what happens to our body with exercise and why it's important has been really, really vital in developing this role. Working on the wards for such a long time has been really helpful in terms of thinking about the whole NDT as well. So I'm not just a physio, it's talking to patients, but then recognizing actually, do we need to get the OT involved here? Do we need to look into other services that this patient can access? So yes, exercise is obviously what my key aim is, but it's also thinking about other forms of the whole patient approach really, and how else we can support them. So for example, I've got one patient that I spoke to yesterday actually, managed to get him in touch with a local group that's going to do some relaxation with him because he was really struggling with breathlessness, but also anxiety and managing in the pandemic. So it's trying to think of them as a whole and how else we can support them.
So it sounds more like not exclusively, but giving individuals the skills and the confidence to this phrase self-manage themselves better, to get the best out of that, to give them permission, to give them guidance in that type of way.
Yeah, exactly. Yeah. So it's been really, really eye-opening, but also really rewarding, talking to some of these patients who might have been living with pulmonary hypertension for years, but they've never spoken to a physio, they've never had those conversations around exercise. So in the past, we know patients were almost advised against exercise and we didn't really know how safe it was, but actually there's been so many studies and loads of evidence and recommendations in the last 10, 15, 20 years. So we know exercise is safe with pulmonary hypertension, and we know how important it is to keep active. So yeah, it's really rewarding when you have those conversations with people who were not really doing much or weren't sure what to do, and being like, actually, it is okay, like things looking stable, like let's try and get you moving a bit more and seeing if that helps with how you're feeling and your breathlessness, but just in your general lifestyle and keeping you as active as possible.
Okay, and benefit from physical activity, doing more. Is there evidence that you feel better in yourself psychologically, mood-wise? You mentioned things like anxiety and things like that. You're doing more. Is there evidence that it actually has a positive on the psychology and the psyche that we do?
Yeah, absolutely, absolutely. So we know there's loads of evidence to support exercise. So not everybody gets benefits from exercise, regardless if you have a health condition or not. So the benefits include kind of your heart strength, your breathing, but like your muscles and your joints, but also there's a massive psychological benefit from exercise, so helping your mental health and feeling happy in yourself from doing it. So yeah, regardless of if you have a condition or you don't have a condition, exercise is important for everyone and it should be encouraged for everyone. Yeah, so yeah, really lots of evidence to support exercise and being active.
Can we just talk a bit about, Katie, before we drill down on some specific questions, but are you aware of, I'm aware of some of them, but the barriers that some people have, you know, if you've got a diagnosis of pulmonary hypertension, barriers people face when it comes to staying active, things like when I do more, I get more breathless, so why do you want me to do more? What about those barriers? And some, you know, if you could mention as well things like, I've been told in the past not to do less because it makes you breathless. Just talk about that, yes.
So lots and lots of barriers to exercise, and again, when you have pulmonary hypertension, they're probably going to be heightened a little bit. So like you mentioned, breathlessness, so that's probably one of the main don't want to say barrier, but the main symptom that people report to me, and this fear of being breathless and not knowing how far to push themselves. So when you have a heart or a lung condition that makes you breathless, it can be quite scary to then go and push yourself into further breathlessness. But unfortunately, if people limit what they do because of the breathlessness, then that has a knock-on effect on our whole physical ability. So your muscles might get a bit weaker, your breathing you might feel a bit more breathless. And then when you go to exert yourself, if your muscles are not as efficient as they were, and your general exercise ability has gone down, that's going to have a knock-on effect and make you feel potentially more breathless. So yeah, breathlessness is a massive symptom that people report. But actually, we know for exercise, it is important to get a little bit breathless in order to get the benefits of exercising. Breathlessness is a good thing, but it's important that we measure it at the right level. So I say this to everyone that I talk to, we do a talk test. So to be guided on how far to push yourselves, depends on your breathlessness. So if you can talk as comfortably as I am now when you're exercising, you're probably not pushing yourself hard enough. Whereas if you are so breathless that you cannot speak, then you're probably pushing yourself too hard. So you should be breathless, but still be able to say a sentence. So that's what I advise people when I talk to them, to try and help support them with that breathlessness and how to manage it. Lots of people obviously have anxiety around exercising. As you said, they've been told in the past not to exercise, and now we're saying, actually, let's start moving a bit more. So that, again, is my role, but also the whole MDT. So if patients are listening to this and they've got a consult or they're going to speak to someone at the specialist centre, it's just saying to them, actually, Ian, I was thinking of going out for a walk, what do you think? And just having those conversations and opening those discussions around exercise and reassurance. Obviously, we wouldn't ask anybody to start a new regime without kind of talking to us or if they had any questions, but just remembering in your consults or your clinic reviews to be like, oh, I'm going to do this, what do you think? Obviously at the moment, being in the middle of a pandemic, motivation is going to be quite a tricky one as well. And that's the important thing with exercise. It doesn't have to be doing anything fancy. It doesn't have to be going to the gym or buying any fancy equipment. It's just setting yourself small little targets and just being aware of your physical activity at home. So
yeah, can we just sort of talk you, because you mentioned the pandemic now, and obviously we're doing this thing now the end of October, the 30th of October, so we're still well in the middle of the pandemic and probably will be for a number of months. We've just completed, we will be publishing next week, so the first week in November, our impact survey that we did in the early stages of the pandemic. And one of the things that we asked them, we had over 800 people who have pulmonary hypertension. They responded. It was a massive response, and we're really grateful. There are two statistics that stand out in this, Katie, and I just wonder if we could talk about this, that 36%, so well over one third, said they'd lost the basic level of fitness during the pandemic. And again, 27%, again, another third, said they gained weight during the pandemic. Does that surprise you? And what do you think we could do to sort of try and correct that? Because people were concerned about this. You weren't just saying, I've become less fit and I've gained weight. They're actually really quite concerned about it.
Yeah, I mean, I wouldn't say it's surprising, but it's definitely worrying. And I think, yeah, I've had lots of people that I've spoken to in the last few weeks or months who unfortunately are reporting their symptoms, and they just have this anxiety, which is appropriately so, about going out and exposing themselves. So lots of people obviously have been shielding. Even if people weren't doing lots of structured formal exercise before the pandemic, just getting out and going for a walk, going to the shops, just being generally active was going to be really good for their, I guess, physical health as well. And now people having lost just popping out to the shops or going for a walk or seeing family and friends, and that's all going to have a massive impact on their physical activity. I guess it's just trying to bear in mind, trying to be mindful of it. So, I mean, I personally have noticed that my steps have dropped off. So now, for example, I use my smartphone and I keep track of my steps every day to make sure that I am doing more than doing what I should be doing. It's just, it doesn't have to be anything fancy, but just being aware of your activity. So it could be standing boiling the kettle and being like, okay, I'm going to march on the spot while the kettle is boiling. So yes, I can't go and do the same exercise I was doing.
It's about doing probably simple things,
exactly,
more frequently. So it's not. It's about doing the right things as well, isn't it, Kate? It's not doing more activity, doing the right type of activity.
Exactly, yeah, exactly. So yeah, just simple everyday activity. And that's the thing with exercise, is people think, oh, exercise, it must be going to a gym class. It doesn't have to be. It can be simple things around your home that you're more aware of. So it could be you're watching telly and the advert comes on, you're like, right, I'm going to stand and I'm going to stretch, or I'm going to march on the spot while the ad is on, or I'm going to do some step-ups every afternoon. I'm going to go to the bottom of my step and I'm going to do some step-ups. Or if you do feel comfortable, going for a walk, doing some lengths of your garden, going to do something where you are more aware of your activity levels. I appreciate it can be very daunting going out with the pandemic, and be very mindful of that, but there are lots of things that you can do at home. And the PHA website is a great resource as well. That's got some sample exercises and advice on keeping active during the pandemic and just in general.
I suppose it's more difficult as well, isn't it, this period of time, or next few months, because in the early months of the pandemic, we were in the spring and the summer, and now we're moving into this winter. So it's slightly, well, we've got much shorter days and things like that. So the timing of doing things and obviously bad weather as well, and people with breathing problems like it with pulmonary hypertension are often find the colder weather more difficult when they're outside. So it is learning how to do things at home. Do you need special equipment at home, do you think, Katie, to do exercises, or
No, absolutely not. So yeah, the cold weather, almost everyone that I spoke to yesterday who said the cold weather was affecting them and going out for a walk. But yeah, in terms of equipment, absolutely not. So I haven't, in the last year, I haven't asked a single patient to go out and buy anything fancy. So lots of people have wanted to, or they've had bits and pieces at home that they might have had over the years, but you do not need anything fancy to exercise. So simple things, like we said, if you've got a step in your home, could you do some step ups? Could you do, and again, it's difficult to say go and do 20, but I would say go and do as many as you feel comfortable doing in terms of your breathlessness, keeping in mind that talk test that we mentioned. But could you do as many as you feel you can, write it down, and then maybe in a few days' time, try it again. You're like, okay, I got 20 yesterday, next week, am I going to aim for 22 or 25? So it's just being mindful of what you're doing. As I said, being active, so being mindful, setting an alarm on your phone maybe, or thinking, right, I'm going to watch an hour of telly, but every 15 minutes I might stand up and have a stretch and have a move around. Or a firm favourite of mine is a good old tin of beans. Any brand will do, but thinking like if you are aware of any exercises that you might have been doing before the COVID, or if you were attending any classes, thinking, right, tin of beans, I'm going to hold them, I'm going to do some bicep curls, or I'm going to try and lift them out to the side, or any, yeah, does not have to be fancy. And even holding on to your kitchen surface and maybe doing a little gentle squat while the kettle's boiling, or yeah, no need to get...
With the baked beans then, Katie, just as a sort of tongue-in-cheek, it doesn't really matter what flavour of beans they are and whether they're low sugar or not, just get the beans out.
Just any tin of beans.
Yeah. I'll tell you one thing, I was struck, I've been struck a couple of times of some of the, because, you know, I'm a nurse consultant in Sheffield as well, and I was having a conversation the last couple of weeks with some patients by telephone, and it's been mentioned twice now to me about the Wii Fit, or whatever it is, you know, the Wii Fit. And one lady I was speaking to, one last, really quite funny, she's 74, and her family bought her a Wii Fit for her birthday, I think it was the end of August, September, and she loves it, and she feels as though she's using it every time she can do it. You know, she can do some of the games with a husband, or when the families could mix with the family, and it just seems it's the obvious stuff, but it's enjoyable as well.
Exactly, and that's exactly what I was going to say. Is, I mean, that sounds great, but it doesn't have to be structured. It doesn't have to be, I need to do 30 minutes and get really, really sweaty. It doesn't have to be any fancy gym class. It has to be something that you can incorporate into your life and that you can enjoy. So that we with the family sounds amazing, but for other people that might be going for a dog walk, or that might be taking the grandkids for a walk, but that might be, yeah, it needs to be realistic and sustainable and something that you will enjoy doing, that you feel the benefit.
It's the enjoyment as well, isn't it, rather than a task. And if you have got somebody, if you're fortunate to have family who live with you, or a bubble, to find somebody who will do it with you, it's good fun, it's enjoyable type thing. Do you think, I know you've touched on it, but I just want to sort of revisit this one. How far do you think people with PH should push themselves? And I think just to revisit these things about levels of symptoms and things, Katie, just to re-emphasise.
Yeah, sure. Yeah. So like I said, it's always worth, in your clinic appointment or when you touch base with your specialist centres, having that conversation and making sure that, you know, everyone is happy for you to start pushing yourself a bit more. But yeah, having those discussions. As I said, the main thing that I encourage people to do is to be guided on how they are feeling. So there's no right or wrong, and what I might go out and I might do a 20-minute exercise circuit, but somebody with the same age and the same height and the same weight as me might do a 10-minute circuit and then have enough. So there's no right or wrong on what you can and can't do. So it's depending on how you feel and slowly building up, okay? So I've had lots of people who have had these conversations with me and they feel really motivated, but I keep reiterating, you need to slowly build up what you can do and what's achievable for you. So anybody, regardless of health condition or not, if they're going to start a new program, if they're going to train for something, they're going to gradually increase what they're doing. So just being sensible, listening to your body. If you wake up and you don't feel well, then you're not going to push yourself into those breathlessness and push yourself a bit harder with activity. So the main things that in terms of pushing yourself, like we said, the breathlessness. So talking, you should still be able to speak, but you should be a little bit breathless. You should feel your heart rate go up a little bit as well. But obviously, if you're getting any symptoms like any chest pain, or if you're feeling dizzy, then you're probably, well, you want to stop at those types of symptoms. Yeah, gradually building up.
Can I just ask you to sort of just talk a little bit, a couple of minutes on, because we talked a lot about breathlessness, and we do in pulmonary hypertension, but also one of the symptoms that we tend to sort of forget a little bit, but patients report it, is fatigue. How to manage fatigue.
Yeah.
From the perspective that you're talking. So what is fatigue? What do we mean by fatigue? And are there ways in which you can manage it better? We can manage it better?
For sure. So I guess fatigue is, to simply put, being tired or having kind of lower amount of energy. So we do have lots of people who report feeling quite tired and low in energy and generally kind of exhausted by the end of the day. And I guess the important thing to remember is when you have a condition where not simple activities, but things like going to get your shopping or walking up and down the stairs, or things that might not seem the most strenuous, when you have a lung condition and you are breathless, doing those activities will exhaust you or will make you have to work harder than someone who doesn't have them. So it is okay to report feeling this, and it's normal to report feeling this. So feeling tired is a very common symptom that people report. In terms of managing it, so exercise, we recommend kind of 30 minutes 5 times a week. But again, it's very specific to you as a person. And if that's not realistic, if that's not achievable, it needs to be done sensibly and safely. So sometimes you might wake up in the morning and feel great. So you're like, okay, I'm going to do a 10-minute of a little circuit at home. And that might be some step-ups, that might be some tins of beans, that might be some chair exercises. But you might then need a rest, and that's fine. But then it's again, maybe in the afternoon, if you feel you've had a rest and you feel okay to do a bit more. So it's about not feeling pressure to do loads, but just incorporating it into your daily routine. So it's like, can I walk up the stairs one more time? Or can I kind of walk down the garden one more time? Or it's just breaking it up and doing it little and often if you can.
Yeah. So really the message there is have a plan to do this, isn't it? Listen to one of the things I often say to people with pulmonary hypertension is that you are the world expert in you. You know how you feel. So listen to your body, but to increase the activity, and we know the positivity of it both physically and psychologically and socially, but it's to have a bit of a plan. So plan to do it, and don't be disappointed if tomorrow you can't do it, but continue, because that's how it is, generally speaking, that some days we feel good and some days we want to do it and some days we don't. So have a plan. So plan, do it slowly, systematically, is I think what you're saying, and listen to your body. I think sometimes it's good to keep a bit of a very simple diary, what I could do today and what I'm aiming to do tomorrow, and sort of that seems could be potentially helpful to have something, a plan type thing, because I think also it's potentially good to share some of that experience when you have maybe a telephone clinic or a face-to-face clinic, to have that as part of what I can do type thing. Do you think, just what
definitely. Yeah, I think.
Sorry, I'm just going to drop this on you. Do you think anything to say about diet and food and exercise, when to eat and when to, if you're going to do sort of 15 minutes exercise or 30, from your perspective, would you advise one thing or another, eat before or afterwards or not?
Again, I think that's quite personal on how you're feeling. Obviously, if you are going to incorporate more exercise or more activity into your lifestyle, you do need to be mindful of your diet, and that you are, I guess, getting the calories and the input that you need. I would say don't do it straight away after a big meal, so maybe like a lighter snack if you are going to do some exercise, because we know if you have maybe a bigger meal, that can make you feel a bit breathless as well. So it's being mindful, maybe like an hour or so after eating, making sure that obviously you've got fluids, that you're in a well-ventilated room, that you've got appropriate clothes on and loose-fitting clothes. But yeah, definitely important. Good rest, good diet, be mindful of what you're eating, because we know having that bit of extra weight on you can make you feel breathless, and it will make you feel a bit more breathless. So yeah, diet definitely not my area of expertise, but definitely.
No. It was more. Yes, I fully appreciate that, Kate. It's just one of these things that people sometimes wonder that am I better eating before and or afterwards. But again, I think it's just what we've been talking about, Katie, isn't it? Is what is best for you. You'll know what's best for you, but certainly not having a biggish meal and then think, oh, I'm going to do my half an hour or whatever it is and that. So, but I mean, it's been really useful, Kate. Just as a sort of round up now, the take-home message for the next couple of months for people who've listened to this, that you know, as far as activity is concerned, rather than exercise and what to do, what would be your sort of top take-home messages for people?
Yeah, so a bit of a cliche, but every little helps. So every little activity all adds up. Okay, so as I said, don't feel any pressure to go and do anything strenuous or half an hour or exerting yourself. It's about little and often and incorporating it into your day and your routine. It needs to be realistic as well. So it needs to be something that you feel you can carry on. So we don't want people to start and sign up to any exercise groups, but then really hate it. It needs to be something that you can fit into your lifestyle and that you can enjoy. You should feel good when you're doing it and after you're doing it. You should feel that sense of achievement. Don't need any fancy equipment. There's lots that you can do around the home. And yeah, just make it about you and make it something that you enjoy. And yeah, have those discussions. So it doesn't have to be with physio. If you're having an appointment, talk to your consultant, talk to specialist nurses, talk to kind of your specialist team about exercise and get those conversations going more.
Yeah.
Sure.
Okay then. Well, stay safe, Kate, and we'll hopefully speak to you again maybe in the new year, which is not that long away now. It'll be a funny Christmas, but in the new year. Okay then. Thank you very much.